love working with clay. It's a terrific medium. You're able to make all sorts of objects in a three-dimensional form and really give a three-dimensional type of story. Because in essence, what I do is I tell stories.
Stacey is strong and is a mental toughness. She is the classic extrovert to my introvert. She is outgoing. She is the idea person. She has big ideas and big plans for a lot of things.
The interesting thing is, I sculpt, but it's actually quite hard on my body. It's also necessary. It's part of how I meditate. My illness is very stress-based in that it is, stress can make it worse. So being able to release that stress in a way that is constructive is very valuable to me. And look, she's making this. My name is Stacey. I am 47 years old, and I'm a mother of twins, and I have been diagnosed with Myasthenia Gravis, also known as MG.
Myasthenia gravis belongs to a group of disorders called autoimmune, in which the body has misrecognized a part of oneself and is trying to destroy it. In MG, as we call it, it's attacking the contact point between the nerve and the muscle, leading to ineffective communication, resulting in weakness. Most commonly, the individual presents with a drooping of an eyelid, or both, and blurred or double vision. But they may also have weakness of any muscle that they can voluntarily control, so that of speech, chewing, swallowing, their arms, their legs.
We actually don't know when my MG journey truly began. When I was around 12, my eyelids started drooping.
And so I took her to her pediatrician, and he knew immediately he wanted to rule out myasthenia and sent her to a neuro-ophthalmologist. The neuro-ophthalmologist assured her that she did not have myasthenia because she was too young to have it. So she went on a 4-year journey of just not having really good mouth control and arm control.
So the progression of my illness slowly built up until finally it reached this sort of point when I was 15 where I started going downhill rather swiftly. I was unable to drink from a cup. I would need to use a straw sort of tied into the corner of my mouth. Smiling wasn't really an option. My eyelids would droop, and kind of almost comically, I would need to look down my nose to be able to see where I was going. I also became sick. I couldn't dress myself. And eventually I couldn't swallow my spit, and I couldn't, I was starting to have some problems with breathing even. I was in crisis, and they needed me to start on type of medication that's only used for myasthenia gravis and for nuclear warfare, which has some pretty bad side effects. So they put me in the neurological ICU for about a week. On my birthday, they gave me a catheter to my heart. I went through a series of plasmapheresis or Plex treatments to clean out all of my blood, and that takes 6 sessions over a 3-week period. Turns out my pediatrician's neighbor was Dr. Howard, who specializes in myasthenia gravis. I met Dr. Howard the day I was diagnosed. He was there in the clinic. In fact, I think he may have been the one to give me the tensilon shot that helped diagnose me right away. So I've known him for off and on 30 years, quite a while. And so he was like a father figure to me almost immediately.
The cause of myasthenia, or what exactly turns it on, we don't know. There is an aberration of the immune system. Its symptoms can be quite variable. In the worst of cases, it can be fatal because one loses the ability to breathe. The diagnosis of myasthenia gravis, first and foremost, is a clinical diagnosis. One has to be attuned to the history that the patient is telling oneself, the variable weakness, and then marry that with the signs or the symptoms of weakness that the individual has. In addition to the history and the exam, which is the critical part, we'll often use blood work, what we call serology, measuring these specific antibodies. We can also use electrical studies of nerve and muscle function to guide us, but it's the total picture that we use to ultimately come up with the diagnosis of myasthenia gravis.
I'm every mama. She is still a baby. When I was first diagnosed and I got my first Plex treatment, the nurse had told me that you would only need to come back and get this done again if you have twins, if you get sick, and if you climb a mountain, which at 16 seemed impossible. Well, I did have twins, and I did come down with the flu, and it turns out breastfeeding was my mountain. I knew I was going downhill and I was in a more fragile state because I wasn't able to read some of the bedtime stories to my children. I was slurring my speech while I was talking to clients, and I was having a harder time getting around, so I did end up back in the hospital.
In the moment, my only thoughts are, okay, we're getting to the hospital, we're doing this thing. You go into an automatic mode of you're the support structure. You need to be there to listen to the doctors and figure out what she's going to need while she's in the hospital, how you're going to be able to take care of the kids while she's in the hospital. The terrifying part sort of comes after, in hindsight, when you realize how close things could have gotten to being very bad. And you spend a few nights thinking about that and, well, how lucky you are that she's still around with us.
Stacey is the one that's strong. We're just supporting her. It was good to have the diagnosis so that it could be treated, and to have Dr. Howard be the one calling the shots was amazing because he is the number one myasthenia doctor, I would say in the world, but at least in the United States. So we were very lucky. I felt very comforted that he was taking care of her.
My twin boys are David and James. They love playing Magic and other tabletop games.
Haven't seen you shuffle it yet.
And we enjoy doing that as a family as well. In fact, we love doing family activities together, whether it be trips to the beach or tie-dye every summer. It's been fantastic watching them grow and seeing the bright futures that they have.
Myasthenia gravis cannot be cured, so one has it for life. And we're making progress, though. We have two new classes of drugs. One is called complement inhibitors, and the other is called neonatal FC receptor inhibitors, or FcRn for short. And these drugs works within 1 to 3 weeks. So very rapid onset of action that I can start to get them better. MG is no longer a black box. MG is undergoing a transformation and a revolution that we can now treat very, very effectively. It's a hidden disease in many aspects, but it's one that we as a neurological community, as a research community, have been very gratified over the last 10 years on the advances we've made and that are going to continue to happen in the next decade to 2 decades to come.
You like your kaleidoscope? Yeah. It is very nice.
I want my story to be a success story, to be a story of hope, and recognizing that you have so many opportunities. I want you to understand that, yes, there are limitations, and it's certainly frustrating when your muscles decide to paralyze on you. Absolutely frustrating. But keep going. There's still a bright future ahead.